Over to Dr. Nibriti.
Well, hello everybody. Nice to find all of you here. So I think we should start right now. So the Group 2 team leader, Dr. Arindam Ghosh, will start his presentation. He had been a true team leader in the true sense. Please, Arindam, you start. We won't waste any time just talking. Okay?
Okay. Thanks a lot, ma'am. On the right of the offset, I would like to thank Dr. Sanjay Bedi sir for organizing this whole thing, and especially Dr. Sujita ma'am and his team for commencing a journey which will be continuing today with our group mentor, Professor Nibriti Das. I would like to introduce myself, Dr. Arindam Ghosh, and I'm the team leader. I have assumed the role of team leader today of this group, and I'll be presenting the competencies 3.1 to 3.10. Here is a snippet of our active team members who have presented, who have contributed to this slide very actively, and they will also be a part of this presentation. Here I am in action. I am introducing the whole thing, and the sessions, our sequence of presentation will be myself, and I'll be reading out the SLOs, followed by Dr. Bhavesh, Dr. Aritri, Dr. Ponudhali, and Dr. Archana. After enumerating the SLOs that we have prepared for the competencies, we'll be presenting the modules for ECE, CBL, case-based learning, few modules of self-directed learning, as well as integrations by Dr. Ponudhali and Dr. Archana. And it will be followed by model questions. We will be presenting model questions for a few competencies over here. And so in the course of time, we'll be adding the whole thing in the Google Classroom. And lastly, it will be summarized by our group mentor, Dr. Nibriti Das, and then the forum will be open for question and answers. Now, here is the sequence of the presenters. All right, now I would like to say that, declare and give a consent that the sequence of presentation has been decided by mutual consent of all the active group members. Okay, so without any further ado, let's get started. So, competency 3.1. It says discuss and differentiate monosaccharides, disaccharides, and polysaccharides, giving examples of main carbohydrates as energy fuel, structural element, and storage in human body. Now this is huge. There are so many things into this single competency that we had to divide this whole thing into sub-competency. So I will be telling the SLOs one by one. First, there will be sessions on monosaccharide, approximately a 2-hour session. So the SLOs for this session are at the end of the session. The first year MBA students should be able to identify monosaccharide, disaccharide, and polysaccharide based on their structural differences. Identify different isomeric forms of glucose, namely stereoisomers, optical isomers, epimers, anomers. Elaborate the properties and reactions of monosaccharide, namely mutarotation, reducing property, osazone formation, formation of esters, and amino sugar formation. Elaborate the glycation, advanced glycation, and carbonylation reaction of monosaccharides, their health implications and applications in diagnostic laboratory. This is our in a 2-hour session, we should cover all these aspects of monosaccharides. Now we are continuing with competency 3.1, disaccharides. In disaccharides, the student should be able to first define glycosidic bond, then identify the common disaccharides present in human body and their component monosaccharides with the type of glycosidic bonds between them. And they should also justify sucrose as a non-reducing disaccharide and sucrose as an invert sugar. The polysaccharides, according to our team, the competencies, the SLOs that should be attributed to polysaccharides are describe the structural attributes of glycogen and its difference with starch. Explain how the structural characteristics of glycogen makes it ideal storage form of glucose. Now, the 3 pages that you saw are all that we have in 3.1. The preferred teaching learning method are lecture, small group discussion, as well as self-directed learning. And the assessment are structured essay questions, SAQ, MCQ, and flashcards by Vagosi. Next, we move on to competency number 3.2. Okay, competency number 3.2 and 3.3, they are very similar. Describe the processes involved in digestion and assimilation of dietary carbohydrates and their storage. Describe and discuss the digestion and assimilation of carbohydrates from food. So close, right? So we have clubbed them and prepared the SLOs together. Now I must mention, being the team leader, that the first draft of these 3.2 and 3.3 SLOs have been prepared by our team member Dr. Bhavyasri, but she requested any member to present this on her behalf because of her pressing familiar and professional commitment. So Dr. Bhavyasri, on your informed consent, I go forward with the SLOs of 3.2 and 3.3. At the end of the session, the first year MBBS student should be able to define the process of digestion of food, name the major dietary carbohydrates, describe the process of digestion of dietary starch to glucose with the intermediate formation of dextrins in the GIT, specifying the enzymes involved, their location, and their specific actions. A big objective, but all of it is important, each and every word. Justify why dietary cellulose serves as an undigested roughage in humans. Describe the digestion absorption of dietary disaccharides. Explain the biochemical basis of lactose intolerance, its symptoms, and laboratory reports. We continue. Explain the mechanism of the transport of glucose by S-GLUT1 and GLUT2 through the intestinal brush border and illustrate the same diagrammatically. Describe the common biochemical and clinical features of GLUT2 deficiency. Explain the biochemical basis of the efficacy of ORS, oral rehydration therapy, in treatment of diarrhea. It's followed by describe the mechanism of intestinal transport of any other dietary monosaccharides. Discuss the mechanism of inhibitory effects of ouabain, cytocalastin, and fluorescein on the intestinal glucose transport. So just two one-liner competencies has got so much in it. So the teaching learning methods again are lecture, small group teaching, case-based learning, especially for the lactose intolerance. It can be a very good case can be designed. And the assessment methods are structured essay question, SAQ, MCQ, and case study, and followed by charts in Viva Bosi. Now this concludes competency 3.1, 3.2, and 3.3. And our next presenter will be Dr. Bhavesh, and I hand the podium over to you, sir.
Where is Bhavesh now?
Just a moment.
Dr. Bedi, just presenter
Yes.
kar dijiye.
Dr. Bhavesh, please share screen.
I cannot.
I think the presenter will remain the same. I mean, they are all the slides are with Dr. Arindam himself.
Yeah,
Yes,
slides
sir.
are all in the same file.
Okay.
Only the presenter has to be changed.
Only the speaker has to be changed. Presenter will remain the same.
Yes, exactly.
Hello. Hello
Yes,
everyone.
yeah. When
I am going to present competency number 3.4. The competency is define and differentiate the pathways of carbohydrate metabolism, pathways glycolysis, gluconeogenesis, glycogen metabolism, and HMP shunt. Next slide, please. Hello.
Arindam, please change slide. Yes.
Okay, these are the learning objectives for the glycolysis. At the end of the session, first year MBBS students should be able to define glycolysis, they should state the cellular location of glycolysis reactions, state the functions of the glycolysis, identify energy consuming steps of the glycolysis and energy producing steps of the same, discuss the committed step of the glycolysis, describe the regulatory steps which are irreversible steps of the glycolysis, and describe the reversible steps of the glycolysis that facilitates the gluconeogenesis. So these all learning objectives we can include in one lecture for 1 hour teaching session. And next slide please. So for the continuation of for the same session, in another lecture we can arrange this type of the learning objectives. Students should be able to describe the poisons that inhibits glycolysis, their name, mechanism and the point of poison's action. Then describe strategies of regulations of glycolysis and differentiate the regulations of glycolysis in muscle and liver. Calculate the energetics of aerobic and anaerobic glycolysis. Describe the junction points of glycolysis that interlinks with other metabolic pathways. And lastly, to report the genetic and metabolic diseases which are related to glycolysis in 1 hour teaching learning or 1 hour lecture. Next slide please. So in session for the gluconeogenesis, we can prepare this type of the learning objectives. At the end of session, first year MBBS students should be able to they should be able to define what is gluconeogenesis, to state the location of gluconeogenesis reactions, state the significance of gluconeogenesis, describe substrates for gluconeogenesis pathway, then describe the different enzymatic steps of glycolysis which are specific for gluconeogenesis and which are common with the glycolysis but in reverse direction. Then discuss energetics of gluconeogenesis, describe enzymatic and hormonal regulations of gluconeogenesis pathway, and lastly describe the interference of excess alcohol in the gluconeogenesis. That we can cover, either we can give as a small self-directed learning previously before we are taking the lecture for the same in 1 hour teaching hour of lecture. Next slide please. These are the learning objectives for the glycogen metabolism session. At the end of session, first year MBBS students should be able to describe the structure and function of glycogen, then define what is glycogenesis and glycogenolysis, describe the steps involved in glycogenesis and glycogenolysis with involving enzymes and coenzymes, differentiate energy production from glycolysis in muscle and liver, describe the reciprocal regulation of glycogen synthesis and breakdown, and lastly the differentiate regulation of glycogenolysis in muscle and liver. The teaching learning methods either can be lecture or small group discussion, and we can teach in for the 2 hour session. Next slide please. For the continuation of this glycogen metabolism, we can also arrange a session for the glycogen storage disorders with their learning objectives. Enlist the glycogen storage disorders, compare and contrast different glycogen storage disorders relating the enzyme defects and clinical features involved in respective disorder. Teaching learning methods are the same, lecture or small group discussion, and for the 1 hour. Next slide please. These are the session for the HMP shunt pathway. So at the end of the session, the students should be able to first classify metabolic fats of glucose 6-phosphate, state cellular site of HMP shunt pathway, locate the tissues most enriched in the HMP shunt pathway enzymes and their functions, discuss the interrelationship of HMP shunt pathway with main 3 metabolism like glucose metabolism, fat metabolism and nucleotide synthesis. Then name the regulatory steps of HMP shunt pathway. Name the important products synthesized from the HMP shunt. Then describe the regulation of HMP shunt pathway. Discuss the physiological significance of HMP shunt pathway. And lastly, report clinical significance of HMP shunt pathway. We can arrange this session for the 2 hours as a lecture or small group discussion. Next slide, please. So that we have covered the learning objectives and teaching learning methods for competency number for 3.4. Now we move ahead on competency number 3.5. So that is the describe and discuss the regulation, functions and integration of carbohydrate along with associated disease or disorders. Next slide, please. So these are the learning objectives for this integration of carbohydrate lecture session. That is, the students should be able to enlist various pathways of carbohydrate metabolism. Then explain and illustrate how does the carbohydrate metabolism plays a central role in donating carbon skeleton to other metabolic pathways. Then describe how glucose 6-phosphate, triose phosphates, pyruvate, acetyl coenzyme A, TCA cycle intermediates and HMP shunt intermediates that are channeled to different metabolic pathways, how they are channeled with each other pathways. Then discuss how are the above metabolites replenished by the pathways of amino acid and lipid metabolism. And lastly, as a disorder, explain the manifestations of metabolic syndrome and diabetes mellitus as the outcome of interlinked deregulation of carbohydrate and lipid metabolism. That we can again plan first, as we already covered the metabolism before. Then we can plan as a SDL session. We previously, before taking the lecture, we can give as a self-directed learning, and after that we can discuss the same in the lecture. In total 2 hours as a teaching session. Next slide, please. So I complete my part. I request Dr. Aritri for their part.
Dr. Aritri, please unmute yourself.
Yeah. Hello.
Yes.
Good evening, everyone. Good evening to my respected facilitators, my dear colleagues, and all who are watching this, because this is very important these days, having this e-learning and of course following the competencies which are directed by MCI. So I'll be continuing with competency 3.6, which says describe and discuss the concept of TCA cycle as an amphibolic pathway and its regulation. Next slide. So, in this competency, at the end of the session, the student should be able to illustrate the organization and function of pyruvate dehydrogenase complex, its reactants and products. They should be able to enumerate different cofactors, the cellular localization and tissue distribution of pyruvate dehydrogenase. Next, they should be able to explain the overall relevance of TCA cycle, its cellular localization and its tissue distribution. They should be able to name the different intermediates of TCA cycle and to show the enzymatic steps involved in their formation. The next SLO will be explaining the strategy of sequential removal of carbon dioxide with oxidative decarboxylation, generation of NADH and intermediary thioester formation with generation of a single GTP ATP molecule in one single cycle. Next slide. Next, they should be able to describe the anaphylactic reaction for the TCA cycle. explain the anabolic role of TCA cycle and its interlinks with different metabolic pathways. Next is the interpretatory part. They should be able to interpret and predict the biomedical and potential clinical consequences of deficiencies of different enzymes like citrate synthase, isocitrate dehydrogenase, alpha dehydrogenase, coenzyme synthetase, succinate dehydrogenase, and malate dehydrogenase, which are very important in TCA cycle. Now, these competency can be taught in lecture. Further on, we can assign this a part of few SLOs in small group discussions in self-directed learning, and that can be completed within the time of 2 hours. To assess this competency, we can follow different structured essay questions, SAQs and MCQs as well. Next slide. Okay. Now I'm continuing with the next competency, that is competency 3.7, which says describe the common poisons that inhibit crucial enzymes of carbohydrate metabolism like fluoride and arsenate. Slide change, please. Yeah. So under this competency, the students will be able to write the reactions of glycolysis which is inhibited by arsenate, and they should explain the mechanism of inhibition of the step. Further, they should be able to explain how the energetic of glycolysis is disturbed by arsenate poisoning. To explain how the inhibition of glycolysis at a single enzymatic step by arsenic can inhibit the whole pathway. And finally, they must be able to explain the action of fluoride in inhibition of glycolysis, specifying the reactionary step and the application of the same in blood sample collection for estimation of blood glucose. Now, this competency can be completed in a time frame of 1 hour following lectures, different small group discussion, and self-directed learning. Again, that can be assessed by structured essay question, SAQs, and MCQs. So that's all for competency 3.6 and 3.7. I'm handing over the mic to Dr. Arindam for the next participant.
All right, our next presenter will be Dr. Archana. Now, it may seem the sequence has broken. All right, Dr. Archana just presented 3.7, and Dr. Archana will be presenting 3.9. Because 3.8 and 3.10 has been prepared by a single man presenting it all together. All right, so here Dr. Archana will be presenting 3.9. Over to Dr.
Yeah, thank you, Dr. Arindam. Good evening, Dr. Bedi sir, Dr. Nebrati ma'am, and my dear colleagues. So I'm going to present on competency 3.9. So the competency is discuss the mechanism and significance of blood glucose regulation in health and disease. Next slide, please.
Change this slide.
Next slide. So the teaching learning method is lecture, small group discussion. So here at the end of the session, first year MBBS students should be able to define hypoglycemia and hyperglycemia and their impact on human health. Discuss the source of glucose input to the blood. Discuss the role of various organs for the removal of glucose from the blood and mechanism of glucose transport to adipose tissue, muscle, and brain, specifying the transporters. Explain the role of insulin, glucagon, and other glucogenic hormones in regulating blood glucose level. Discuss why regulation of blood glucose is vital for survival, especially for the functioning of brain. Discuss the significance of insulin independency of brain in uptake of glucose by it in contrast to the adipose tissue and the skeletal muscles. Describe the regulation of blood glucose in the fed state and fasting state. The student should be able to define and classify diabetes mellitus and discuss the metabolic derangements in diabetes mellitus. The students can be assessed based on the structured essay, SAQ and MCQ. Thank you. Over to Dr. Punadali.
Dr. Kumari, you can go ahead with competency 3.8 and then 3.10, and then we'll be moving to the next segment of our presentation.
Okay, good evening, everyone. First of all, I would like to thank Dr. Nibriti ma'am for all the motivation and support. Madam was with us throughout the whole process, kindly encouraging us all along. Thank you, ma'am. Now to competency 3.8. To discuss and interpret laboratory results of analytes associated with metabolism of carbohydrates. The expected learning level will be knows and knows how. Next slide, please. Next slide. Next slide, please.
Yeah, it is
The first will be session on galactosemia. It will be for 1 hour. At the end of first phase of MBBS, the students will be able to discuss the biochemical basis of galactosemia and the metabolic alterations, explain the clinical presentation of a child with galactosemia, enumerate the diagnosis and management of children with galactosemia, interpret a case report with blood or urine laboratory findings in a child with galactosemia. The TL methods will be SDL and case-based learning. Assessment will be SAQs, MCQ, OSPI and case studies. Next slide. Next will be inborn errors of fructose metabolism. It will be for 1 hour. At the end of this phase, students will be able to enumerate the biochemical basis of the inborn errors of fructose metabolism, list out the clinical or laboratory findings in the disorders, interpret a case or laboratory report of a child with fructose intolerance. The TL methods will be lectures, small group teaching, CBL. Assessment will be SAQs, MCQs and case studies. Next slide. Mucopolysaccharidosis. It will be for 1 hour. And at the end of this session, the students will be able to.
Dr. Sucheta wants
Yes,
to
sir.
say something.
Am I audible?
Yes.
Yes, ma'am.
Dr. Sucheta, ma'am, you can you unmute yourself? Yes.
Good evening.
No, I don't want to say anything now.
Okay.
It's okay. I'm just putting my views in the chat box. You can discuss it a little later when everything is over. Let's not,
Yes.
stop this flow.
Yes, ma'am.
Yeah.
Okay,
yeah.
ma'am.
Thank you.
Thank you. Okay. At the end of the first phase, students will be able to define mucopolysaccharides, name the mucopolysaccharides, their locations and functions in our body, enumerate the mucopolysaccharidosis, their biochemical defects and clinical presentations. Interpret a case report of mucopolysaccharidosis with the given blood or urine lab findings. TL methods will be lectures, IGL, integrated teaching, SGT and case-based lectures. Assessment will be by SAQs, MCQs and case studies or charts. Next slide, please. Next will be competency number 3.10. This will be here interpretation of the results of blood glucose levels and other laboratory investigations related to disorders of carbohydrate metabolism. The expected learning levels will be knows and knows how. Next slide. Next slide, please. Here the first session will be on glycemic status and control, which will be for 1 hour. And here the SLOs will be, the students will be able to, at the end of the session, students will be able to name the common biochemical tests in blood and urine that is done in the laboratory to assess the glycemic status of an individual, state the normal levels of fasting, postprandial and random blood glucose levels, define hyperglycemia and enumerate the causes, define hypoglycemia and state the causes. TL methods will be lectures and small group teaching. Assessment will be by SAQs and MCQs. Next slide. Next will be a session on glycated proteins, which will be for 1 And the SLOs will be, the students will be able to define glycated hemoglobin and the biochemical mechanisms involved in its formation, state the normal serum HbA1c levels and its changes in hyperglycemia, discuss the utility of measuring serum HbA1c levels as a tool in assessment of glycemic control in patients with diabetes mellitus, and enumerate the role of fructosamines in the assessment of glycemic control. TL methods will be lectures, SGT and CBL. Assessment will be by SAQs and MCQs. Next slide, please.
Next slide.
Next slide. Next will be GTT session, which will be for 2 hours. And at the end of the first phase, students will be able to define GTT and list out its types, describe the steps of OGTT procedure along with the indications and contraindications, tabulate the plasma glucose levels in normal, impaired glucose tolerant and diabetic individuals, discuss the indications, screening and diagnosis of gestational diabetes mellitus based on OGTT, ADA criteria, and interpret the OGTT reports to get an impression about glycemic status of the patients. Identify gestational diabetes mellitus based on the OGTT reports of pregnant women. And the T methods will be SGT, case-based learning and SDL. Assessment will be by SAQs, MCQs and case studies. Next slide, please.
Next slide.
Dr. Arindam?
Slide.
Next slide.
Arindam?
Slide.
Yeah.
What happened?
Slides are not changing.
Okay.
Hello, Dr. Arindam?
Arindam, just
Yeah, it has come.
Yes. Next will be laboratory diagnosis. Yes, ma'am. Laboratory diagnosis of diabetes mellitus, which will be for 2 hours. And again, the objectives will be, the students will be able to define diabetes mellitus and enlist its types, discuss the biochemical basis of type 1 and type 2 diabetes mellitus, enumerate the ADA diagnostic criteria of diabetes mellitus, state the outline of management in diabetes mellitus, interpret the given laboratory blood or urine sugar report of a patient with diabetes mellitus. The TL methods will be early clinical exposure, IGL, PBL, SGT, and case-based learning. Assessment will be by modified essay questions, SAQs, MCQs, OSPI, and case studies. Next slide.
Next slide. I think internet, there is some internet problem. Yeah.
Actually, metabolic syndrome, which will be for 1 hour, given a test to us, it will be for 1 hour. And the objectives, SLOs will be, at the end of first MBBS, students will be able to enumerate the characteristics of metabolic syndrome and the clinical implications, enlist the criteria to diagnose metabolic syndrome, and interpret the case or laboratory report of a patient presenting with metabolic syndrome. TL methods will be ECE, IGL, SGT, CBL. Assessment will be by SAQs, MCQs, OSPI.
Next slide.
Arindam?
Where is Arindam?
I'm here. I have changed my, I think the connection is left. That's why I'm having problems.
Your net is gone.
Okay.
Please. Sir, I have the slide. Is it reflecting? I think there's a delay due to the poor internet connection on my end.
I'll just try.
Sir, I have clicked on the give control of keyboard and mouse control to you. I think you can control this remotely.
Can you see my screen? Can the participants see my? No.
We can see the screen which was there.
Sir.
Right.
The next slide, sir. Next slide, please.
Okay. Is it okay now?
Yes, yes, sir.
Yes,
Okay.
sir.
The next slide.
Yes.
Next
Yes.
one, sir.
Yes.
Next one, sir.
Yes, sir.
Yes, sir. Next will be a session on diabetic ketoacidosis, which will be for 1 hour. And at the end of first phase, so it is gone, sir.
The previous slide.
So previous slide, sir. Previous slide, sir.
Yes. It has come.
Yes, sir. Nice, sir. Here the students will be able to enlist the acute and chronic complications of diabetes mellitus, define ketoacidosis and name its types, explain the biochemical basis and clinical presentation in diabetic ketoacidosis, enumerate the laboratory findings in a patient presenting with diabetic ketoacidosis, interpret the blood or urine report of a patient with diabetic ketoacidosis and starvation ketoacidosis. The TL methods will be IGL, integrated learning, PBL, small group teaching, and CBL. And assessment will be by modified essay questions, SAQs, MCQs, OSPI, and case study. With this, I finish my competency 3.10. Next will be assessments by Dr. Bhavesh. Over to you, Dr. Bhavesh.
Okay, thank you, ma'am. So I am going to present some of the examples of assessment methods for competency number 3.4 that I prepared. Next slide, please, sir. Next slide, please, sir.
Yes.
Okay, yes, sir. So for the topic of glycolysis, I have prepared this some short answer questions like of completion type, end product of glycolysis in red blood cell is blank, and like multiple completion type, the pancreatic hormone blank favors glycolysis by increasing activity of blank and blank type of the enzymes. Then another types of the same multiple completion, like for plasma glucose estimation, blank type of top color vacuum are used, which is coated with blank that inhibits the glycolysis. So we can I have prepared this type of different comprehensive types of the different short answer questions. So I'm not going to read each and every question. So next slide, please, sir. Another types like multiple choice questions I also prepare like assertion and reason type. That assertion is the reactions catalyzed by phosphofructokinase is committed step of glycolysis. The reason is phosphofructokinase converts fructose 6-phosphate to fructose 1,6-bisphosphates, and options that we are generally giving as in assertion and reason type. Like if the both are true, R is explain A, or R doesn't explain A, or A is true and reason is false, or reason is true and assertion is false. Another type of MCQ we can prepare like single response, that is following vitamins are required for utilization of pyruvate except like riboflavin, thiamine, pyridoxine, and niacin. So I have just prepared some of the examples of different types of the questions. Next slide, please, sir. So for the topic of gluconeogenesis, I have prepared this one MCQ that is of multiple response type. The options are first, stem contains the old chain fatty acid is substrate. Second is insulin stimulates the gluconeogenesis pathway. Enzymes of pathway is located only in cytoplasm. And fourth stem is fructose 1,6-bisphosphatase is key enzymes of pathway. So the question is, which of above assertions are rightly related to gluconeogenesis? So I have given different options. Either 1 and 2 is right, 2 and 3 is right, 3 and 4 is right, or 1 and 4 is right. So this is other examples of MCQ in gluconeogenesis of multiple response type. Next slide, please, sir. So for the glycogen metabolism, same I have prepared assertion and reason type of the MCQ. I'm going to read only one first question. Assertion is branching in glycogen increases its solubility. Reason is the branching increases the number of reducing ends in the glycogen. Either the both are true with R explains A, both are true but R doesn't explain A, or assertion is true, reason is false, or reason is true or assertion is false. Likewise, another question, insulin activates glycogenesis, that is assertion, and reason glycogen synthesis active in dephosphorylated state. Same options I have given. Next slide, please, sir. Okay, sir. For the HMP stunt pathway, I have prepared this one modified essay question that contains different types of open-ended and multiple completion types. First question is write the oxidative reactions of HMP stunt pathway, naming enzymes and coenzymes for 2 marks. Then main purpose of HMP stunt pathway is to produce blank and blank, that is for 1 mark. Enlist the physiological functions of HMP stunt pathway. Draw a flowchart of 2 functional mechanisms of them, that is for 2 plus 3 marks. Then state the adverse effects of primaquine drug administration in a patient deficient of glucose 6-phosphate dehydrogenase for 1 mark. And lastly is the name the enzyme of HMP stunt pathway and its clinical importance that uses thymine pyrophosphatase coenzyme for 1 mark. So total I have prepared for 10 mark modified essay question. So that completes my examples of assessment question. Then I hand over to Ponnudali ma'am.
Thank you, Dr. Bhavesh. And for the competencies 3.8 and 3.10, I have prepared certain topics for integration and SDL. First will be a laboratory diagnosis of diabetes mellitus. Here, sharing of objectives can be done between anatomy, physiology, and biochemistry. And nesting of objectives from pathology and general medicine can be included in our lesson plan. And correlation can be done by using a case scenario which can be used as a linker to correlate the concepts learned in the basic science subjects. Next topic for integration will be diabetic ketoacidosis. Here nesting of objectives can be from general medicine can be included in our lesson plan, and it can be planned as a vertical integration session also. Next slide. Next slide, please. Next slide, sir.
It is here.
And next topic is metabolic syndrome. No, previous slide, sir. Metabolic syndrome. Here nesting of. Next slide, sir. Here nesting of objectives from general medicine can be included here, and correlation can be done using a case scenario which can act as a linker to correlate the concepts learned. I have given a case scenario here which is present here. I'm not going through the details. And next will be integration of topic. Next integration topic will be of mucopolysaccharidosis. Here again nesting can be done with pediatrics. Next slide, sir. Next slide, sir.
It is there.
No, ma'am. Next. Certain topics can be given to the students as self-directed learning sessions. I have given a few such topics. First, we can give pictures of insulin therapy in children with diabetes mellitus type 1 or videos related to it to the students. And we can ask them to present seminars on role of insulin in health and disease. And next can be, we can give a case scenario of diabetes mellitus type 2 patient and give it as a project or group work, and the students can be asked to prepare a concept map on diabetes mellitus. Then a laboratory report of diabetes patient can be given to the students as a clinical reasoning exercise. Then a topic like GTT and overview can be given to the students for poster presentation by the students in groups. Next slide, sir. Next slide. And case scenarios of galactosemia or hereditary fructose intolerance can be given with photographs of the affected children, and the students can be asked to write assignments on these disorders. Next slide, sir. Next will be case-based learning. Here students will be divided into groups, and a case scenario can be given to them as a whole to work with, or components of the case can be released sequentially as triggers as in modified case-based learning method. The discussion questions, next slide, sir. The discussion questions can be posed by the facilitators now and then to the groups to encourage discussion and give them a direction to the case-based discussion. Then the groups will be asked to present their findings in the next session. This is about case-based discussion. with a diabetes case, which is presented here. Next slide, sir. Next slide. These are some of the questions which can be posed by the facilitators to the groups to encourage discussion and to give them a direction. So these are sample questions which are given here. That's all about case-based learning. So these are the modules that can be given to the students: integration, STL, and case-based learning. Next will be Dr. Archana. Thank you, sir. Thank you, ma'am.
Yes, thank you, Dr. Punantali. So here I'm going to discuss about the integration. This is based on the competency 3.9. So diabetes mellitus is a topic. So integration can be done with general medicine. So the main aim is to discuss the metabolic derangements of diabetes mellitus and discuss the clinical aspects of diabetes mellitus. So to go about the procedure, as a biochemist, we can discuss about the blood glucose regulation, and the physician, they can discuss about the clinical aspects of diabetes mellitus. So the salient features which should be discussed are the pathology behind diabetes mellitus, clinical features of diabetes mellitus, laboratory investigations for diabetes mellitus, management of diabetes mellitus, and the complications of diabetes mellitus. So for SDL, metabolic syndrome and microalbuminuria can be given as a SDL topic. Next slide, please.
Next slide, please.
So now we'll see the early clinical exposure. This is a module based on diabetes mellitus. So here the setting will be classroom or OPD, where the students will be taken in groups to look into the case. So the topic of basic science is carbohydrate metabolism. So the main goal will be the student must be able to list out the clinical manifestations of diabetes mellitus and enumerate the laboratory investigations for diagnosing diabetes mellitus. Next slide, please. So the expected competency is metabolic derangements in diabetes mellitus and the biochemical test done in diabetes mellitus. So at the end of the session, first year MBBS student should be able to elicit the clinical features of diabetes mellitus, explain the significance of estimating blood glucose level and urine glucose, and the role of glycated hemoglobin in management of blood glucose and interpretation of blood glucose test. So by giving various laboratory investigations, the student should be able to interpret the values. Next slide, please. So here the total learning experience allotted is 3 hours, where the first 20 minutes comprises of introduction. So how this ECE is going to take place, how the students are going to be distributed, and the instructions will be given and what the student is going to learn about in this session. Then exposure to clinical content and discussion in small groups, which will be done for 60 minutes. So students will be shown a case in case of OPD, and they will be shown the laboratory investigations, and discussion will be done for 60 minutes. Then DOAP, that is demonstration, observation, assessment, and performance by using the glucometer for estimating the blood sugar level. So that will be for 30 minutes. Then summary and conclusion for 10 minutes. Then reflective writing by the students for 20 minutes, where they will write what they have learned, what they have understood, their experience in looking into the case in the OPD, and what are the skills they have learned from this early clinical exposure, and how he is going to apply this knowledge in his career. Then the assignment like MCQ for around 10 minutes. Next slide, please. So this is an example in case if it is a classroom setting, a case scenario will be given where the student will be explained about what is this case scenario, what are the alterations in this particular patient, and what are the investigations which are done in this patient, and mainly the role of glycated hemoglobin in this case will be discussed with the students. Next slide, please. Thank you, ma'am. Now I'll hand over the mic to Nibriti, ma'am, for the summary. Thank you.
So, hello everybody. Am I audible? Can you hear me?
Yes,
Yes,
ma'am.
ma'am.
Okay. So the work is in front of you. In summary, I will say it had been absolutely a teamwork. My job was to keep in track and keep them on track. and it was a really very heartening to see how the groups built up. It is just like the enzymatic reactions as the first lag phase, and then the internal bonds started forming, then the energy barrier, the energy hell reached, and then there is the product formation. So the teamwork has been excellent, and the a little introduction to the team members. Dr. Arindam has a 6 months baby, but he did absolutely very good leadership role just to start with the formation of the group till assignment of the job, and then ultimately ensuring that the job is ultimately done, and the presentation also he took the charge of conducting the presentation. If he had been the leader, everybody had the potential of being leader, that I could see. So his two hands had been other two, Bhavesh and Ponurhalli. Bhavesh is stays in a very remote village, and he had access to computer only in his office, and he was absolutely busy in the office, overloaded in the office work. In between, he was preparing all these tasks, and the same was Panurali was the single person to do everything in his department. And while Archana thought that she will just finalize her presentation 3 days back, her mother-in-law got the wrist fracture, so she had to run around the hospital. So just now Arindam came after silencing his baby. He and Aritri both were really trying to give company to the baby. He called very loudly both the parents. So despite that, they have really worked. They had remained active. They did not get demotivated, and that is a pleasure. I loved seeing them, how they got mature as the team worker, how they really shifting the leadership. Suppose the starting of the SLO making started with the other two seniors, and these other two comparatively juniors, they had been the helping hands to all these three. So it was a really
now can we just have a little bit of
now
discussion?
it is open for discussion and question. I take a back seat. Answers are also by the team, and every suggestion is really welcome, so that they can improve upon, and we can improve upon whatever we have done. So, and they will as a reflective writing, they will write up all the suggestions, and it will be reflected by their corrections and further improvement. Thank you so much. Thank you, Dr. Sucheta, to have given me this opportunity, and Dr. Bedi, I loved this involvement.
But you have done, your group has done a great job. Applause to all of you. And there are a few apprehensions about carbohydrates. There I have put one, and I'm sure in the CBME biochemistry people are writing, because I think the total number of hours for the whole course is 80 lectures, right? Am I right? Can anyone say whether I'm right or wrong? How many lectures?
Absolutely right.
Yes, ma'am, you're right.
You're right.
80
lectures.
hours, ma'am.
So if we say 80 lectures, I think you will need to group 3 will have to compute how many lectures you have said, and somewhere for first MBBS at least, that I have that SLO 3.6, the last SLO may not be so relevant. So there are a few things that we need to relook. We have also, group 1 and 2 have also put in their SLOs on the Google Classroom. So I don't think all of us should take this, as just abhi kar diya, ho gaya, khatam baat. Each one of us should opine on all the SLOs, if we think that they need some modification. So I would encourage all of you to even relook at group 1 and 2, their the subgroup 1, and just check those SLOs also. All right, related to enzymes and cell. And now we will look at even these carbohydrate. And because the next week is a sort of a holiday, because we're not meeting on the 22nd, so let's use this time so that we can consolidate everything. Group 1 and 2 had not presented the MCQs and the SAQs, etc. We are already preparing them, and we will put them up also on the Google Classroom for all to opine. Okay, but plus if anyone else wants to say anything right now, can put in the chat box or may mention. If you can, Arindram, if you can just look at SLO 3.6, competency 3.6.
Sound is not coming. Unmute yourself.
I am audible. And the 3.6 competency says describe and discuss the concept of TC cycle as an amphibolic pathway and its
The last
regulation.
one. The last SLO. The last SLO.
Yes, ma'am. Yes.
3.10.
SLO, the competency is very minimal, but the last SLO that we read out is predict with interpretation biochemical and potential clinical consequences of deficiencies of citrate synthase, isocitrate dehydrogenase, alpha KT dehydrogenase, succinyl CoA synthetase. I mean, ma'am, all the deficiencies.
Can I see that slide?
Ma'am, I am not operating the. Dr. Bedi is operating the slide
Dr.
from
Bedi,
his end.
can we see that slide?
Slide number 23, sir. It's slide number 23.
Also, metabolic syndrome, no, at this level, I think should not be in such great detail. But others can opine. Okay, I may be wrong. No, not this one. Not this one. Go to the next one. This one. 3 points. No, one before. Yes, the last one here. Explain the strategy of sequential removal of carbon dioxide with the oxidative decarboxylation generation. I don't think at first MBBS level that kind of an SLO is necessary. But of course,
I say something. This makes understanding TCA cycle easy. Just one carbon is going off, and ultimately you are getting to oxaloacetate. It is just
but
that.
it is too chemical for a medicine student to comprehend. I mean, to do anything about it. It's remember, I mean, that's my opinion. So anything else that anyone wants to discuss? But I'm so sorry, I need to go today a little early before, putting sort of saying bye-bye to all of you. I mean, till this whole thing is ends. But over to you, Dr. Nibriti, you can take this forward and ask people if they need any other discussions.
And thank you so much, Dr. Sucheta. I'm really thankful.
Thank you. I'm so sorry that I have to go.
Thanks a lot, ma'am.
Okay, fine. So please, any point, any query?
So I don't see any hands. So I think we can end it here.
If it is so,
one thing I missed out, I must add that the whole module, the whole slide background, the whole decorative thing has been done, painstakingly done by Dr. Ponnudhali. She has taken the headache of merging all our individual satellite slide into this whole single coherent thing.
She has been the right hand to the team leader, and to start first also.
And lastly, we had the biggest academic catalyst and promoter form of Professor Dr. Nibriti Das. Ma'am, the sheet anchor of our group, and I don't think we would have done anything without your everything. So thanks a lot, ma'am.
Hello.
That's not, that is
Hello.
kind of, okay. Any
Hello.
other?
Good evening, madam. Good
Any
evening,
other?
madam.
Good
Hello.
evening. Hello, good
Uh,
evening.
I want to ask you about the MCQs, whatever displayed in the slide. Is it
Yes.
necessary to be so complicated or for this phase 1 student? Something
No,
AR करके जो आए थे वो
no, those are just, I
MCQs.
think it was more of a framing of the MCQ in the technical.
Yes, complicated. Yeah, the
Can always be decided as someone takes the class, and as per the SLO it is okay, but yes, one has to think which is not that much of basic, but something very important basic also has to come. So
yes.
that is okay. Oh, I mean, that is the example, not exactly it has to be like that, but technically yes,
Okay.
MCQ are written like that. Otherwise, it is entirely on the teacher. Whichever way teacher feels that this is the best relevant for this particular slot, the relevance is very important for remembering that the student is going to be an MBBS doctor, not exactly a biochemist. That is important. And many SLOs can be in any of these competencies, can be cut short, but only the thing whether it will be really agreed upon by most of the colleges who have been traditionally teaching so many things, just slashing everything may not be, which we did in quite a bit at AIMS. I have done lots of slashing, but what I find that medical colleges really still teach quite a bit. We simply did out with the amino acid synthesis, only general strategies, but medical colleges do have it. So therefore, and moreover, it is a teamwork. So I didn't put exactly what I feel. It is what you people all suggest. We will accept that and take that for further improvement of the teaching methodologies and teaching per se.
Okay, ma'am, this is Anita here. Nice presentation, very detailed. I had a couple of queries. One was, I think, both galactosemia, that is galactose metabolism, mainly dealing with galactosemia, and fructose metabolism, mainly dealing with fructose intolerance and any other metabolic disorder associated with it. These two are forming the non-core subjects. But the way the SLO was written, it was as though it was a core subject, those two. And one of my colleague also had put up that the uronic acid pathway was not touched upon. And these two, galactosemia and fructose intolerance, could have been, or inborn errors of fructose metabolism could have been dealt as just an ECE and both of them together in 1 hour. So what is your opinion on that, ma'am?
This is a very good suggestion. And these two topics, because it is a teamwork, I did not interfere much on that, not at all. So yes, we have done that as a case-based learning. We don't take a for glycogen storage, for fructosuria, galactosemia. We don't take any class and just make it as the whichever way, a case or is followed by questions, or SDL, even SDL. We just give the chart of these glycogen storage diseases, tell them the students to study, and any of the next session for half an hour, we just discuss and tell them what is what, tell us what is the symptoms and all, and we finish up. So it is very much accepted. Your suggestion, this can completely go away from the main lecture slots, and so lots of lecture time can be saved, and it is not needed also.
Okay, one more thing about criterias for diabetes mellitus. I don't know, I lost connection. I don't know if anybody has mentioned. Only ADA we don't teach. We teach them even WHO criteria and tell them what's the difference between the two. Well, that was not indicated in any of the slides.
Okay, please make a note of this. Okay, So that is important. Yes. That is very, very important.
Yes. Any more hands? No more hands. So, ma'am, can we end?
Let me thank to all of them for very nice and very really good suggestions. So the group will work on that. That is true. SLOs have to be shortened. Many from the classroom should go to other modes just to fit in the assigned hours and so on and so forth. And thank you to the group also and all of you for being here and encouraging the group participants. Thank you so much.
Thank you.
Any
We will
other
continue
question?
the discussion on WhatsApp.
Thank you, ma'am.
Thank you.